Hi, everybody. I'm Dennis Prager. Wonderful to be with you. Today's my birthday, and this is the official inauguration of PragerU Fundraising Month on my birthday each August 2nd. PragerU.com, 833-PragerU. And I thank you. Get a lot of warmth. Get a lot of hate in life, and I get a lot of love in life. And might I add that each in their own way make me feel wonderful. The love is very deeply touching and moving, and the hate means I'm effective. So there you go. Is that a fair way, living martyr?
Yeah, I think it's very fair.
They keep reporting on the COVID cases in Florida because they're dying to bring down DeSantis. The media has no agenda of truth; it has political agendas. So we keep reading about cases of the Delta variant. I like that. I got to remember that. If you call somebody a Delta variant, is that a mean thing to say? You know, you are one Delta variant. What do you think?
Not much of that.
You don't think much of it? No. Oh, that's fair. It's a fair reaction. So, I have a question. Who cares? Cases means nothing. Death means something. Serious illness, prolonged serious illness means something. Cases means nothing. If theoretically there was what comes after Delta? Epsilon? Seriously, in the
so.
Epsilon?
Yeah, but
So if there's an Epsilon variant?
there is a gamma. There is one.
There's a Gamma variant?
Yeah,
How do they pick it out?
I don't know. And there's a lambda.
And a Lambda variant? Ooh.
They're coming next.
How about a Phi Beta Kappa variant? There you go. Let's say there's a Phi Beta Kappa variant. And everybody has it, but nobody dies. So 300 million cases, and nobody dies. Does it matter? How many Americans get a cold every year? Would you say a third of the country gets a cold every year? I would say so, right? 100 million cases of cold. Why isn't it reported? Because they almost never lead to death. That's what matters. The mayor of Washington, D.C., did you see that? She's having a big celebration. She had one right after telling Washingtonians that they had to wear masks. She didn't have masks. So here's the question. Since I have contempt for all Democratic politicians because they're destroying the country. Either they're destroying it or they're allowing it to be destroyed. So putting that aside, however, how do you explain that you did that? Like Newsom having an unmasked gathering at a restaurant while forbidding restaurants to be open in California, or people obviously attending them. So how do you explain it? Is it hypocrisy? It is hypocrisy, but hypocrisy doesn't really explain it. The question is, do they believe what they're telling us to do? That's what is fascinating. That's one of the fascinating questions to me. See, I believe some of them are simply scared. I believe that many of them, like Nancy Pelosi, doesn't believe in masks any more than I do. Remember, she was caught. Nothing happens, by the way. When Democrats do these things, look at Cuomo. With all the women who came forth, the guy is still pontificating to the country what to do. So how does one explain this? Some of them are truly, that is, Democratic politicians, are truly paranoid. They're scaredy cats. But most of them don't believe what they tell you. Nancy Pelosi went to an underground speakeasy hair salon to get her hair done while screaming lockdown in California. The mayor of Washington, D.C. just had a big event right after telling people that they can't gather and without masks, and did so. So they don't believe it. This is all done to control you, but they don't want to be controlled. So I just thought I would share that for the record. Principia Scientific International, July 19th. 5 times more UK child suicides than COVID deaths during lockdown. 5 times more children and young people committed suicide than died of COVID-19 during the first year of the pandemic in the United Kingdom, according to a study which also concluded that lockdowns are more detrimental to children's health than the virus itself. No kidding. The virus is meaningless with regard to young people, especially children. But what we have done to them, deprive them of a year of schooling, deprive them of friends, not allow them to see faces other than their immediate family. Every time I see a 3-year-old, 2-year-old with a mask on at an airport, I'm embarrassed to be an American. It takes a lot to embarrass me to be an American, although it's taking less and less because it's happening more and more. But this is a phenomenon. 2-year-olds wearing masks. 3-year-olds, 4-year-olds, 10-year-olds. 5 times more children and young people committed suicide than died of COVID. We ought to put this up. Did you send me this? Researchers with the University of College London, the University of York, the University of Liverpool, and the University of Bristol found in a study that has not yet been peer-reviewed that the coronavirus doesn't appear to present a significant risk to children as compared with other age groups. What I don't understand. What do you need a peer-reviewed study for? You just look at the data. How many kids have died of this, and how many? It's nothing. It's virtually nothing. I would suspect that more kids have died in car crashes.
Well, I do have an interesting.
You want to say it on the air?
Yeah.
Here we go, ladies and gentlemen. The Living Martyr, a rare appearance on the radio.
So I did talk this weekend to a major economist who is close friends with another major economist. This hasn't been published yet, but I think it will be very soon. And that is, your child is more likely to die in a school bus accident
than from COVID. Wow. That's hard to believe because that's so rare.
That's the whole.
But none of them are dying of COVID. Yes. Another great reason to homeschool, says. Between the two of you, I'm really entertained. Sometimes I just think I should just, sort of take a break, sip on my coffee, and have the two of you, he in his serious way and you in your hilarious way. Thank you. That is really something. I would not be surprised. Okay. I would be a little surprised. Let's put it that way. It's coming. Yeah. The risk of removal of children and young people from their normal activities across education and social events may prove a greater risk than that of SARS-CoV-2 itself. That's the study's conclusion. It was revealed in the study that only 25 children under the age of 18 died of COVID-19 from the start of the pandemic until the end of February 2021. Around 61 children in all died after testing positive. But in 36 cases, it was found that the virus did not contribute to their death. But during the same time period, there were 124 suicides among children and 268 deaths from trauma, the study's authors found, while noting the virus is rarely fatal for children. That's right. Professor Lorna Fraser of the University of York added, Even when we found higher risks for some groups with severe medical problems, these risks were still very small compared to risks seen in adults. Lockdowns are causing a spike in children harming themselves and drug overdoses among children. Do you know what the definition of both a liberal and a leftist? They don't ask the question, what price?
The Dennis Prager Show.